Medical explorations. I'm Mrs. Cassis. No phones allowed. This is a junior and senior class. Be prepared to fail.
All around me are familiar faces, worn out places, worn out faces. My top college choices were CU, Gonzaga University, Creighton University, University of San Diego, Santa Clara, and St. Louis University. I ended up choosing Creighton University because of its outstanding academic opportunities, religious aspect, and community. Creighton was ranked one of the best colleges in the Midwest last year. It has a reasonable tuition, great athletics, scholarships, opportunities to study abroad, and service opportunities including mission trips. Creighton is also a small to medium-sized school, which is what I'm looking for. It also has a good student-to-teacher ratio and male-to-female ratio. Creighton, in addition, has a large program to becoming a BSN, the degree and title that I'm striving to earn. Creighton is a great school all around, and this is why I chose it. Some of my core courses were contemporary composition, philosophical ideas, and understanding of natural science, as well as applied nursing ethics. My total credits were 52. Some of my major requirement courses were basic human anatomy, nutrition, nursing management, and nursing management of pharmacotherapy. My total credits were 78. Upon completing these courses, I successfully graduated from Creighton University with a Bachelor of Science in Nursing. Bright and early for their daily races, going nowhere, going. Some of my college choices were Duke University, Gonzaga University, University of Santa Clara, Notre Dame University, Vanderbilt University, University of North Carolina, Chapel Hill, Auburn University, and Clemson University. I ultimately chose to go to Gonzaga. I chose the school because of the general location, which is Spokane, Washington, near downtown, along with the fact that it includes many of the things that I'm looking for in a school. It has a study abroad program, which is one of the top things I was looking for, along with good financial aid and athletics. The school also has many intramural sports and clubs that I can participate in throughout my schooling. The general size of the school, which is medium to small, is the ideal size I was interested in, and when visiting the campus, it was very pretty and the dorms were satisfactory. Some of my core classes include philosophy of human nature, world or comparative religion, communication and speech, as well as basic math and English, with a total of 45 credits. Some of my major requirements were information flow and biological systems, general chemistry, bioanalytical chemistry, and physics, with a total of 62 credits. Upon finishing these credits, I graduated from Gonzaga with a Bachelor in Science in Biology. Their tears are filling up their glasses. No expression, no expression. Hide my head, I wanna drown. My top graduate school choices were University of San Diego, University of North Carolina, Chapel Hill, St. Louis University, and University of California, San Francisco. I ended up choosing the University of San Diego. I chose the University of San Diego for my graduate degree because of its ranking in nursing, location, size, and service opportunities through nursing. USD is one of the top graduate schools in nursing, specifically in the degree I chose, of family nurse practitioner and pediatric nurse practitioner. In addition, the location is in a beautiful and warm area near the beach. The size is small to medium, which is what I am looking for. In addition, there are opportunities to do mission trips combined with nursing in the Dominican Republic and Haiti, something that really sparked my interest. These are the reasons University of San Diego interests me. Some of my course requirements were methods of translational science, primary care, health policy analysis, and advanced pathophysiology. After I successfully graduated from the University of San Diego, I am now a BSN and an FMP and a PNP. This took a total of 6 years, 4 for my undergraduate degree and 2 for my graduate degree. My top medical schools were the University of California, San Diego, Northwestern University School of Medicine, University of North Carolina, Chapel Hill School of Medicine, and Vanderbilt School of Medicine.
I chose to go to UC San Diego Medical School because I felt it would be the best fit for me. Upon looking at the school and the opportunities it offered, I was very interested. I liked that there was some religious affiliation at the school and the organizations it offered to undergraduate medical students. The location of the medical school is also appealing to me. It is located right on the main campus in La Jolla, and it is surrounded by research institutions and resources. I am most excited about the program instituted at the school. Like all medical schools, it is a rigorous program, but it will help me reach my end goal. Some of the required courses from a medical school were Foundations of Human Biology, Principles of Clinical Oncology, Cardiovascular 2, Endocrine and Reproduction, as well as various labs and hospital experience. I received an MD in BSc after medical school and undergraduate school. Upon graduating, I applied for residency programs at Johns Hopkins, Northwestern, and UC San Francisco, but I ultimately chose San Francisco as it had my ideal location, pay, and was a top program. My total schooling was 12 years, 4 undergraduate, 4 graduate, and 4 for residency. 4 years later, in Paris, France, Katie, there for Doctors Without Borders, and Caden, on vacation, meet again.
Coming out of college, I had the option to work for an ICU, the ER, urgent care, a pediatrician's office, Doctors Without Borders, or nursing home/assisted living care. I chose to work for Doctors Without Borders. A nurse practitioner working for Doctors Without Borders travels to poor, damaged, or war-affected areas of the world to treat and care for patients in need of care they are not receiving. A nurse practitioner will do a wide range of duties, from medicating a sick patient to feeding a hungry child to organizing programs to prevent diseases.
Help me with my water inspiration. Is there a doctor around?
I'm here to help!
Oh, thank you.
I'm not trained with. Is there an OBGYN anywhere?
After my residency program as an OBGYN, I had the choice to work at a hospital or a private practice. I chose a hospital. An OBGYN is a physician who specializes in women's reproductive health and pregnancy. As an OBGYN, you specialize in the diagnosis, treatment, and prevention of diseases and disorders that affect women, such as breast cancer, cervical cancer, and menopause. Additionally, you work with expectant mothers throughout their pregnancies, during childbirth, and into postpartum.
I'm an OBGYN, but first I need my scrubs. Thank you so much for helping, Caden. I was just on vacation. Gloves, anyone? Of course. Thank you. How are you feeling?
Not good.
It's okay.
All right, miss. I'm gonna need you to push. How many kids are you having?
I think one.
Okay, let's get started. Like,
8 hours later.
congratulations, miss. You're a proud mother of many.
Thank you.
Along with delivering babies, I have many job duties as an OBGYN. Some of my job duties include providing medical care related to pregnancy or childbirth, diagnosing, treating, and helping prevent diseases of women and those affecting the reproductive system, providing general medical care to women, examining patients yearly or more often when the patient is pregnant, diagnose medical problems concerning mothers and babies, treat various illnesses and diseases, perform minor surgeries and laser procedures, monitor the condition of both mother and unborn babies, manage labor process, and care for the mother after the baby is born. My pay scale is between $230,000 and $319,000 in Denver, Colorado. I work an average of 80 hours per week, but because delivery is so unpredictable, there are night shifts and sometimes 24-hour shifts, as seen in this case where I had to work outside of my job. My patients are women and mothers, babies in the family of mothers and babies. My colleagues include physician assistants, nurse practitioners, other OBGYNs, and physicians, surgeons, nurses, and neonatologists.
Miss, do you want me to clothe your child?
Oh, sure.
What's his name?
It's actually a her. Actually, I don't really know. I think
Oh,
it's a her.
okay.
Yeah, so, her name is Maria.
Oh, Maria.
No. Medea.
Medea. Along with clothing and caring for people of all ages, from newborn to elderly, I have a variety of jobs as a Doctors Without Borders nurse practitioner, including taking part in organizing a mass vaccination initiative, for example, measles, training an influx of displaced people fleeing conflict, running a program to prevent disease, for example, mother-to-child transmission of HIV, operating a feeding center, initiate a training program for local medical staff, hospital organization, oversight of hygiene measures, management of drug stocks, data collection, and contact with local authorities. My pay scale is $18,000 to $21,000. The hours I work are full-time, whenever I am needed, day and night. My patients range in age from young babies to elders with disease, injury, lack of food, effects from war, and others. My colleagues are physicians, registered nurses, social/aid workers, surgeons, anesthesiologists, nurse anesthetists, and OBGYN. That was a very stressful situation.
That's definitely a con of my job. I have a really high stress rate, especially with difficult patients.
I can imagine. But isn't it cool getting to deliver babies?
That's one of my favorite parts of the job. I love being able to deliver babies. I could like barely understand her accent though.
Yeah, that's a con of my job because we have to be fluent in French to get the job.
It must be really cool though being able to travel the world.
Yeah, it's really cool being exposed to diverse cultures and languages.
You must have to have a really specific personality to work for Doctors Without Borders.
Yeah, I'm an ENFJ actually.
Me too.
Wait, really? That's
Yeah.
crazy.
I know.
An E, being an extrovert or someone really outgoing and good with people and interacting with people is really helpful in my job because I can interact with patients and work with the patients really well.
It's the same with being an OBGYN. Same with being an intuitive too, because you get to be very open-minded, especially when diagnosing patients. You have to look at the bigger picture and what could be. But it also can definitely hurt you because you don't focus on the little details as much.
Yeah, same within my job for sure. Being a feeler can also be good and bad, as you're very tied to your emotions and you make decisions based off of those emotions. And I think that sometimes in my job and yours, like that can definitely make it more personal and make it more emotional for you, and also be less focused on the facts. But it can also be good.
I can see that. And being a judger is really helpful, especially with organization, because judges tend to be very organized and they have a strict schedule, which is very good. But also with our jobs, because the hours are so different, we also need to be flexible.
Kaden, have you ever had any crazy cases?
I haven't had one, but I've heard of one. OBGYNs actually have one of the highest malpractice rates. In one case, a jury awarded a family $55 million in a Johns Hopkins malpractice case. After hours of labor attempting to deliver her baby at home, Rebecca Fielding was brought from her house to the hospital. However, she waited more than 2 hours for emergency C-section. As a result, her baby has severe permanent mental and physical disabilities, such as cerebral palsy and a seizure disorder caused by lack of oxygen to the brain. The doctor showed extreme negligence to his patients, as well as breach of duty. Have you had any weird cases?
Yes. Well, not personally, but I have heard of some crazy legal cases. But nurse practitioners, only 1.5% of them have had to make malpractice payment over their study. And between 2003 and 2013, only 2,000 nurse practitioners have had malpractice cases. So it is a relatively low amount. But one case I've heard of is a nurse practitioner was on call at a pediatrician's office, and the father of a boy calls in with symptoms of the flu, nauseousness, sleepiness, rectal bleeding, and bleeding from the mouth, as well as the boy had slept for 24 hours straight. And the nurse practitioner said he just had a viral illness and said he could come in to the office the next day. But it ended up being diabetic ketoacidosis, and the boy actually died that night, which was a breach of duty because the NP omitted to taking any action, and the NP was sued heavily.